Hey guys, what's up? Hope you all are doing well. Any topic suggestions are welcome. Please do mention in the comment section below. So let's start our today's video without any delay.
Click on Zombie Apocalypse.
In this video, we'll discuss about some of the major conditions related to the thyroid gland. Before starting the video, if you haven't seen my previous videos on thyroid hormone synthesis and hypo and hyperthyroidism clinical features, I'll leave the link in the cards. Please check them out. These are the conditions related to the hyperthyroidism. Let's go with Graves' disease. It is an autoimmune condition affecting the woman between 30 to 50 years of age. It is an syndrome consisting of symptoms of hyperthyroidism, goiter, that is swelling of thyroid gland, ophthalmopathy, pretibial myxedema. It is an autoimmune condition where the autoantibodies to TSH receptors are secreted by the immune system, which thereby stimulate the thyroid hormone synthesis and secretion as well as the growth of thyroid gland. Infiltrative ophthalmopathy and dermatopathy are specific to Graves' disease. Bacteria like Yersinia enterocolitica and E. coli possess cell membrane similar to TSH receptors. The antibodies produced to these microbial agents cross-react with TSH receptors and thereby affecting the thyroid follicular cell. Iodine supplementation in iodine deficient areas like hilly regions triggered the development of thyrotoxicosis in the patients who have pre-existing subclinical Graves' disease. Clinical features are similar as hyperthyroidism. Features specific to Graves' disease are ophthalmopathy and infiltrative dermatopathy. Ophthalmopathy leads to proptosis and lid retraction, preventing the complete closure of eyelids. As a result, it causes corneal ulceration. Compression of optic nerve by enlarged muscles lead to blurring and visual acuity changes. It also causes color vision changes. Pretibial myxedema or infiltrative dermopathy. It is seen in Graves' disease but is less common than ophthalmopathy. It occurs in patients with chronic illness. It is caused due to accumulation of glycosaminoglycans, especially hyaluronic acid, in the dermis. Clinical features include non-pitting, edema, and induration of skin in the form of papules or nodules. Treatment. Most patients are asymptomatic and do not require any treatment. Indications of treatment. Treatment is required when there are symptoms like itching and local discomfort. 0.02% fluocinolone under tight plastic wrap can be used for treatment. It is a glucocorticoid. Subacute thyroiditis or recurrent thyroiditis. It is an inflammatory disease which might probably caused by a virus. It is characterized by neck pain and the goiter and thyroid dysfunction. Viruses like Coxsackie, mumps, measles, adenovirus may commonly cause this disease. Initially, there is hyperthyroidism followed by a transient phase of hypothyroidism. Treatment modalities include usage of anti-inflammatory substances like non-steroidal anti-inflammatory drugs or steroids to control inflammation and beta blockers like propranolol to control thyrotoxic symptoms. Coming on to swelling of thyroid gland or goiter. Simple goiter. It is swelling of thyroid gland in spite of having a normal thyroid profile. Clinical symptoms include a diffuse thyroid swelling, tight sensation while swallowing, and a three-folded increase in thyroid gland. No pain and local lymph node enlargement are seen. Treatment. There is no necessary treatment to be taken as it may regress eventually. Endemic goiter. It is seen in areas of iodine deficiency. All thyroid function tests are normal. Prevention includes fortification of common salt with iodine and intramuscular injection of 3 to 4 ml of iodized oil once in 2 years. Multinodular goiter. It refers to multinodular enlargement of thyroid gland. Patients present with symptoms of thyrotoxicosis. The goiter is large nodular, causing stridor due to tracheal compression, dysphagia due to esophageal compression, hoarseness of voice due to recurrent laryngeal nerve compression. No treatment is required if the goiter is small and the patient is having normal thyroid profile. However, the follow-up is required or else it may progress to a toxic multinodular goiter. Partial thyroidectomy is indicated if there is a larger goiter. Iodine 131 can be used in elderly patients. Coming on to diseases of hypothyroidism. These are some of the major diseases related to hypothyroidism. Hashimoto's thyroiditis. It is a chronic autoimmune inflammatory disease, more common in women. There is lymphocytic infiltration and is a most common cause of hypothyroidism in iodine sufficient areas of world. It may sometimes be associated with other autoimmune disorders. The goiter may be firm or in rubbery consistency. All the features of hypothyroidism are present. Anti-TPO and anti-TG antibodies are present in serum. Biopsy shows profuse lymphocytic infiltration, lymphoid germinal center, destruction of thyroid follicles, and fibrosis. Treatment includes usage of thyroxine to correct hypothyroidism as well as to shrink the goiter. Myxedema coma or Myxedema madness. It is a life-threatening condition with patients having a long-term untreated hypothyroidism state. Symptoms like decreased mental status, hypothermia, and other psychotic features are present. It is a severe medical emergency where the treatment should be given immediately, or else it may be fatal. There may be an underlying infection present. Management: patient should be shifted to the ICU immediately. Drugs like thyroxine 300 micrograms is given intravenously 5 to 10 minutes initially, followed by 100 microgram per day until patient becomes alert and able to take thyroxine orally. If IV preparation is not available, then the same dose may be given through Ryle's tube. Supportive treatment includes usage of hydrocortisone 100 mg IV bolus followed by 100 mg every 8 hours till associated adrenal insufficiency is excluded. Covering with blanket to correct hypothermia. IV fluids and rehydration drinks should be given to prevent hypoglycemia. Mechanical ventilation if needed. Treat the underlying causes such as infections. Avoid sedatives and narcotics. Hope you all have liked this video. Please do like, share and subscribe if you find this informative. See you in the next video.